But you mentioned that influenza, other illnesses were looked at in this study in their relation to depression or some sort of disorder, psychiatric disorder. COVID it's 2 times more likely to have a psychiatric disorder with COVID than with those other illnesses. Will you just talk about why that may be?
A couple things. I mean, I guess the first thing is typically when you have any of those other issues, you can easily seek out your doctor, and your doctor will usually, at least in the last 100 years, willingly help you out and not treat you like an other or have you stay in some room or put you in isolation. Additionally, we don't have any significant treatments that are known to help. There's also a lot of unknown about the outcome, especially with the media harping and focusing on the deaths that are associated with it. A lot of people take that out of proportion to what their risk of death might be when they get it as a 28-year-old or a 30-year-old.
Yeah, so you think there's just a lot of misunderstanding or a lack of information out there, and that breeds fear in people and makes them think,
Yeah, I think if we kept up with the deaths of influenza every season on the TV, we probably would also be a little more concerned about our diagnosis of influenza when we get it in November of last year. Mm-hmm. So,
is there anything else in this study that you're seeing, the reason behind why people are getting psychiatric disorders, period?
Well, I mean, additionally, the infection itself has a significant, if you get actually pulmonary disease from it, it does cause a significant amount of shortness of breath. And shortness of breath is an anxiety-provoking symptom. Not being able to feel like you can breathe and not knowing why that is, other than an infection that you know little about, can cause a lot of consternation.
Yeah. And you did mention that, some of these other viruses, some of these other diseases, you have outlets, you have places to go. In COVID, you may feel like you're isolated on an island, right?
Yeah, exactly. So, historically, if you felt bad in the past, you would go see your doctor. Your doctor would probably be able to see you face to face, give you advice, tell you exactly what you can do for this, and also give you probably some reassurance about what was your risk associated with this.
Yeah. And so what is your message to people out there who may have had COVID and are now suffering from psychiatric symptoms? I know that we've opened back up more than we were, in the spring as far as hospitals. What's your message to people suffering?
Well, I think one of the first things people can do is, just like when somebody has the flu, you can have somebody else say, "Hey, I had it last year. It stinks, but I'm better." I think anytime sharing your experience with somebody else is important, and I think sharing that experience in a way that is comforting, not exacerbating or scaring somebody about it, should be important. Most of the reports in the news or on TV are about the worst things that happen during a coronavirus infection. And in all honesty, 95 to 99% of the infections are things that completely recover and have no sequela from the infection. So again, sharing that with the world is probably an important thing. And it also probably would help the person that had it know that, hey, I've had it and I can help somebody else.